Good evening. Thank you for joining us. We're going to get started in just a few moments. Thank you for joining us for tonight's webinar, Careers in Healthcare Startups, presented by CTAHE and Playback Health. Our program will begin in just a few minutes. Thank you for joining us. Tonight's program will begin in 2 minutes. We will begin tonight's webinar in just 1 minute.
Welcome, everyone. My name is Luana Sardina, and I'm a student at the University of New Haven, a member of CTAHE's Education Network Committee, and your moderator for tonight's program. This evening, I want to welcome you all to our webinar, Careers in Healthcare Startups. CTAHE's Higher Education Network encompasses engaged students and faculty. Can you guys hear me okay? Let me see. Okay.
Yep.
Okay, great. Encompasses engaged students and faculty among the undergraduate and graduate healthcare management programs in the state of Connecticut. We have been hosting various webinars on a variety of careers in healthcare, featuring hospital operations, healthcare consulting, and the topic we are going to learn more about tonight, healthcare startups. This topic came about as interest for health systems digital transformation and increased patient and provider satisfaction. And tonight we will hear from Dr. David Langer and Greg Odland on their company, Playback Health. Now let's go over a few details about today's webinar. It is a panel discussion that is 60 minutes in length. There will be about 45 to 50 minutes of discussion, and we will try to leave some room for questions and answers. Today's program is being recorded. The recording will be available a few days session. ACHE National has pre-approved our program for 1 hour of self-reported qualified education credits. Attendees participate in listen-only mode, but can interact using the chat box on your screen. If you have questions during the session, please just type them into the Q&A box or chat box, and we will address them verbally throughout and at the end of the formal program, as long as time allows for. I would now like to take this opportunity to welcome today's panelists. Dr. David Langer is the principal founder of Playback Health, Inc., chair of neurosurgery at Lenox Hill Hospital, and Vice President of Neurosurgery for Northwell Health's Western Region. And Gregory Odland is the CEO and co-founder of Playback Health, Inc. Welcome. To get started, can you please tell us about your healthcare journey and how you got to where you are?
That's me. I think if I'd be lying to you if I actually knew where I was going. It's always easier to describe the pathway that you took rather than think you knew what you were doing at the beginning. And it's really started with a very simple idea that I just noticed that my patients were leaving my office and despite my explaining everything to them, seemed to never remember anything I told them. And that was the kind of the original idea. It really was watching my daughters do their homework one night and seeing them using all these different resources. This is like in the late 2000s, by the way, 2007, 2008. They were chatting, they were screen sharing, they were, FaceTiming each other. And I was just so frustrated because these simple free apps weren't available in a hospital. And so I rapidly started deploying them within my practice so I could screen share with my radiologist or with my nurse or with my secretary, and then got into recording the screens, just doing screen captures and giving it to my patients. And it was very successful, and it morphed into what's now Playback Health, which it touched on the discharge process because the discharge process was so broken, making videos at discharge or recording so patients knew when they went home that their family members would, even if they weren't at the bedside, or their caretakers knew what we told them, especially as it related to what their diagnosis was, what their follow-up appointments were, what their medications were, what additional, things, taking care of wounds, whatever. And just as importantly, the front end stuff, patients in the office on an outpatient basis, getting a video about their care, instructions about the operation they were going to have in a digital format. It's basically, there are two components, basically converting all of the analog things in digital and delivering it on a mobile device. But I think more importantly, using the sensibility of social media with audio, video, texting, and photographs, and creating a deliverable for healthcare, you're on their mobile as well. And that's really what Playback is. It didn't really take off until this guy with the gray beard over here, who I've known for many years, he left his job in Wall Street and was schmying around trying to figure out what he was going to do in the next stage of his life. And Greg's my best friend. He came to me later on in the year after his son had done some work with us. And if it wasn't for Greg, swooping in and really picking the ball up. It's remarkably hard, and I think that's why I think this is an important webinar to do things in healthcare outside in. That building a company and then creating a deliverable to get into healthcare is remarkably difficult. We built this inside out. We were inside a health system, and Greg enabled us to develop the funding and create Playback Health. That's what his wife came up with the name. So we were funded outside the health system, but we had this deep integration and deep experience inside Northwell Health. And the two things made this a successful enterprise. But if it wasn't for Greg coming in and establishing a business that was funded and made, at least broke even for the time being, but also brought in the IT, the developers and the coders and the people who developed the UI and the UX, which is user interface and user experience. He really was the source of developing that skill set. And that's why we are here today.
Thank you for sharing this. How do you continue to grow and develop as a leader?
I think that's a question I'll leave up to Greg as well. I'll start off because I'm very interested in this aspect of my life. Leadership means that you're getting other people to buy into your vision, basically. That it's convincing, showing people an idea, a project, something, and getting them on board with you, and having them as excited about your idea as you are. I've had the honor and the ability, the experience from both the healthcare side with my department to create a very unique culture at Lenox Hill Neurosurgery. But more importantly, I think the most important thing a leader can do is have trust and show vulnerability and not be selfish. And I think one of the reasons why Greg and I work so well together is I've really, given him, he is our leader, and I'm not uncomfortable with that. I have leadership skills, but I also have a full-time job. And so, I've really given Greg the reins to the horse. And even though I couldn't do what he does, you have to know your bandwidth. You have to know you can't do everything. And I think there's a great book called Ego is the Enemy by Ryan Holiday, which is worth reading for anybody who's interested in leadership, where there's a quote that leadership is giving up things that you like to do, but honoring the people around you and giving up the things that you like to do because other people like to do that. And it's not just as far as that I learned, it's not just the junior people that work for me in my department, but more importantly, Greg really loves what he does, and he's done a remarkably good job. It's easy for me. I trust him implicitly, and this relationship's worked out really well. So, I'll let Greg describe what his leadership style is with our team, because I think that it's worked out really well. We have a wonderful, wonderful culture at Playback Health.
Yeah, I guess from my perspective, David was kind of sharing how he came about this idea of how to bridge that communication gap between patients and what he was telling them. For me, it was much more obvious. Our relationship goes back over 20 years. So I've known David for a long time, and I knew about what he was trying to do, but I really didn't get that aha moment until I had my own accident for a period of time. I was racing on bikes, and I went down one time, and I woke up in an ambulance and in the hospital, x-rays, the whole 9 yards. And when I finally made it over to the surgeons to put me back together again, the first thing I was asked when I got there is, can I see your x-rays? And I was like, I don't have the x-rays. You should have those x-rays. They said, no, we can't get them. You have to get them and deliver them to us. So I had to drive back to the hospital, get that little CD-ROM. And when the doctor took the CD-ROM and put it into his computer, I had to take a picture with my phone. That's how I got my x-rays. And on top of that, the nurse practitioner then came in and said, we don't have your discharge instructions. I had to drive back and get the printed out discharge instructions, go back and hand those off because I had taken a cab home and left them in my cab because I was so high on the drugs that they gave me in the hospital. And it's kind of one of these things. My aha moment was healthcare shouldn't be this hard. I shouldn't have to go for back and forth to get my discharge instructions, my x-rays, all of these types of things. So for me, my aha moment was going through that and understanding what David was trying to do and realizing that he's really onto something big. And so for me, it was, you talked about leadership. It's really believing, having a passion in the product that you have. And then after that, it's surrounding yourself with the very best people. David and I always talk about this, you know what you know what you don't know. And very early on, David and I realized like we complemented each other very, very well into growing something like this out of a business. We knew each other super well, but there was a lot of stuff we didn't know. I didn't know healthcare. I didn't know software technology. I didn't know anything about startups other than, the time that I've spent on the finance side. So when we came there, we were very focused on what we didn't know and hiring the best of breed to start this journey. We went through a couple of different development projects and people before we settled on the people that we have now, and they've been with us the whole journey. So it's really making sure that you find the right people and then let people go. And I would say that's probably been one of the most important tenets of our success.
Another thing just to add is when you're trying to start up, obviously the reason many more startups fail than are successful, even people with good ideas and even with money. I think I would imagine that people on this webinar are considering, how do I do that? What do I do? I think you have to really have a lot of self-awareness, and you have to basically, everybody wants to be Mark Zuckerberg. Greg and I are in our late 50s. We're not looking to take over the world here. We want to make a successful company though. And if you're 20 years old and you're starting off, you may have a very different horizon what you're thinking about than we do, because we're doing something great. We know we're doing something great, but control and these things don't bother me, and I don't think they bother Greg. We're willing to give something to get something. That we're not selfish. We're very aware of our unselfishness. We're willing to share because we know what our bandwidth is. We know what we know. We know what we don't know. And so, if you are getting on a startup, I would really urge you to you have to examine yourself and know what you're trying. Is it money? Is it creativity? Is it just want to do something really cool? Like why are you doing this? And just make sure that you are honest with yourself. And you have to take some risk. We failed a bunch of times before. I've had multiple failures because I have a lot of stuff about failure now. But there were some really low moments, right? Was ready to give up, and we never gave up. We still have a long way to go. It's still a nascent company. It's still a fragile, situation. But by the same token, our success is based on, I think, both Greg and I recognizing those things about each other and about ourselves, more importantly. Everybody said, you don't want your best friend running your company. They're probably right in general, but a lot of people who aren't me, I know the kind of person I am, and I also know the kind of person Greg is. And if Greg was different and I was different, this could blow up. But it hasn't, because of that recognition, both of our own weaknesses and our own strengths, being able to give up ground, recognizing the value of other people, and being unselfish. And I think those are really, really important for startups, because I'm sure they fail more often than not on not having those things.
Yeah, everyone definitely has their own paths. And as a student, it's really helpful to hear how you guys grew and developed as leaders. Thank you. What are the most important attributes of successful leaders in your industry?
And I think I sort of spelled it out. You could have a great idea and money and have a bad team. And you have to have all three. You can each have a not such a great idea and have a great team, and you're more likely to be successful the other way around. You can see even large, like WeWork. There's this, obviously there's a lot of focus on these huge failures, but recognize that this is a precarious business we're in. You're spending an awful lot of time, and in order to get investors, you have to kind of make up this glorious future to get people to buy into your idea. Like Elizabeth Holmes, but you have to also know what you're really about. You have to be really honest with yourself and know what your deliverable is. And I think that in the end, those traits are what you have to have. It doesn't mean there's some very selfish, crazy, egomaniacal people who are really successful, but chances are they had an amazing idea, and the people who joined them were willing to accept the weaknesses that those people. And I mean, you can look at Steve Jobs as an example, who his first iteration at Apple, the guy was nuts, but he had such passion, and he had great ideas, and it worked, but then it crashed. And a lot of it had to do with his personality, and a lot of it had to do with his failures. And then he spent his time in the desert and came back and recognized those things about himself. And I think if you want to understand leadership and you want to understand, why people fail and then why people are successful, I think that's a really good place to start. Greg and I could only wish we could be successful as Apple, but you don't have to be the next Apple to have success. And I think Greg and I both understand that about ourselves. We're not trying to, boil the ocean. We want to make a great product. We think we have one. We want to do something good for human beings and, solve a major problem in healthcare. And we also want to have fun. And, we want to enjoy the people we work with. And I know that's leadership, and being comfortable saying that and being able to and bring those people around you. That's what you have to be able to do. You can't have one without the other.
Yeah, I would just follow up on that. You talk about the ingredients of success. One of the people who's not here with us and has been instrumental in our in where we are today is John Lima. He's our COO. And when John first came over, he came over for the same reasons. He's like, I get what you guys do. He goes, I see 200 companies a year. And he goes, this is the best company that I have seen. We really originally approached him to help us with our technology effort. And he ended up quitting everything and coming on board with us full time because he believed in the vision. So you have to have a great vision. But John taught me early on, the idea by product market fit. You have to be solving a problem, a real problem, right? You can't go in you can have a great product, but if you don't have a problem to solve, you're not going to get people to use it as part of their regular routines. So you need to really have a problem. You need to have a solution. So you need to have this idea of product market fit. And I think once you have that, then you have to have great people, you have to have great processes, and you have to have perseverance. And I would probably put more on that. We started out with #grit on everything that we did because we realized at the end of the day, you had to get in the batter's box and swing the bat every single day. It's the only way to get this thing going. But I credit John with introducing me to the concept of flywheel, which we talk about now. It's this idea, and Amazon captured it really super well. But I think it was developed based on UCLA's experience in the NCAAs way back when. But it's this idea of having a vision, having a mission, and surrounding yourself with people who can turn the flywheel. And initially, it's just every day getting in there and turn it. It's really super hard. You've got to find the right people. You've got to find the right process. But as you move through your product and you have success, turning that flywheel gets easier and easier. And eventually, those things that are big headwinds to growth become a lot easier for you to manage through it because you've got the right people, you've got the right process, and you've got the right cadence on your flywheel. And we think about this a lot to make sure that we have the people, the process, and that we're continually feeding back into that flywheel, investing into that flywheel so that you can keep those turns working. It's true for our personal lives, it's true for startups, and it's true for big companies. It's the ones that fail to continually reinvest in their companies that ultimately fail. And so that we're very cognizant of that. And we talk about that quite a bit in our management meetings.
The other thing I tell young people who come to me, whether it's medical students or college students, you're establishing relationships with people now. That if every relationship you have is something to mine and to treasure, because you never know. You can go back and you can tap those people years later. You stay in touch with people. Be open to the other people's ideas. I mean, Matt Whalen, who is now in our company, I met him when I was about 15 years before we started the company. He was working for Apple and he was selling Apple servers. And, I stayed in touch with him and kept, pinging him with ideas over the years. And he kind of knew about this idea I had. And lo and behold, fast forward to 2018, 2019, Greg and I go to California together. We meet with Matt. He makes a suggestion. That's what led to us hiring John, a couple of our guys. And next thing you know, Matt joins the company. So, and he's done a great job with customer relationships. And, I think that never underestimate the value of the relationships you're building from day one, because it shouldn't be it shouldn't be all transactional, but, when you're a good person and you're honest and, people know that you're, for legit, that matters. You can never pull the wool over people's eyes. And so, when you're starting you are a startup right now. If you're interested in being an entrepreneur and you want to, do something cool someday, just to make sure the people that you meet, that you're honest with them and that you are good to them and that you act like unselfishly and be humble, be kind, and it may not pay off every single day, but in the long run, that's all that really matters. And I think our company built that into our culture because so much of that is based on these kinds of relationships.
Thank you for sharing both the success and the failures that you both had. I think it takes a lot of courage for someone to be able to talk about the failures because no one wants to go through it, but having this perfect image is, I think it's just like you said, people want to have that perfect image, but everyone has their own paths and things happen. But I think you can learn from your failures and grow from them. So for those that are new to the idea of entrepreneurship in the industry, could you give an overview of the healthcare startup market as you see it, and how has COVID impacted the landscape?
I guess I can take that. The healthcare market it's incredible. I'm really super encouraged about it. When we first started this, the first question that we got is, are doctors really going to record themselves? And why is this important? And we had initially, I would say, we spent an inordinate amount of time convincing people why Playback was important. Fast forward to today, those conversations don't happen anymore. I mean, it took a pandemic for people to understand how important what we're doing right here now and connecting in this way, how important that is in the process of healthcare. And since I would say over the last 5 years, so much money and so much technology and so much research has been put into understanding how important communication is in the healthcare process, that it is no longer a question. It's more about whether it's important or the will is there. But healthcare has provided so many different avenues of obstacles to delivering transparent care. And it took a pandemic really for people to sit back and understand that, hey, you can use technology to connect with your patients in a way that makes care more easy to understand. And technology allows you to bring people who are remote from the point of care so that everybody can hear and understand those care instructions in a language that they can understand. And so for us, you had asked, like, what are some of the ingredients for success? We talk about people and process. I would also say that luck is a part of it. You look at some of the greatest entrepreneurs that ever exist. There's a ton of luck and a ton of what was other people's obstacles become opportunity. And it's really what you do with that opportunity. And so for Playback, it was, you had cloud computing, and all of healthcare was on their own server farms. So we had cloud computing, which was a huge headache for healthcare. You had this idea of mobile technology that was taking over all of our consumer lives, but it didn't exist in healthcare. And then you had a pandemic. You really had the three things that created a perfect storm for something like Playback Health. And so from our perspective, the thing that really drove our success is being at the right place at the right time. We had a great product, we had a great people, but it really took a pandemic to accelerate Playback in the healthcare arena. And there's still so much low-hanging fruit in healthcare that, for us, how quickly can we build it and deploy it before more established players figure it out and want to build their own. And that's kind of the, that's kind of the big guy, little guy in technology and innovation. You see it all the time, but that's kind of what we're up against. We have a great idea. We built a best product, and now it's just going out and creating the story and creating the viral of using Playback. And we're seeing it now. And it really took a pandemic to accelerate that growth.
I like to use the analogy of, chaos is a great opportunity, and never underestimate the opportunity that's created when everything goes crazy. Many companies if you look at some of the top companies, they really blew up because of some sort of change in the environment. And healthcare is going through a massive change right now. I think COVID accelerated healthcare's IT adoption by probably 10 years. Telehealth, all these tele companies look at Zoom. No one ever heard of Zoom March 15th of 2020. And now it's a massive, you look at this, we're on the Zoom conference. I mean, we never used to do this stuff. And I think Zoom's the best example of filling a critical need. And then the people suffer also. There are companies that have suffered because of these things. And I use the analogy of Dick Fosbury, who was the high jumper who started jumping over the high jump backwards, and everyone was going over forwards. He won the Olympics in Mexico City, a gold medal in 1968, jumping. Dick Fosbury flop, which is the way that all high jumpers jump now. And the reason he came up with this, not because he knew much more than the other guys, but turns out they changed the landing pad from sand to a pillow, and that you could suddenly land on your back or on your neck rather than on your feet. And he realized that if you make a pillow, you can jump a different way. And I think that's the best. I like to think of us that way, that in this COVID or this massive disruption changed the environment to a pillow. And now we have to jump over backwards, just like Dick Fosbury did. And I think there's a lot of opportunity out there for startups right now. And healthcare is wide open because they've adopted the idea that they have to change. They don't know how to do it yet. They have no idea what they're doing, but they're open to it. And so I think this generation of entrepreneurs in healthcare is going to see a lot more positive impact, and they're going to have a lot more success than certainly the prior generation.
Thank you. Yeah, that's very interesting that, with everything going on with the pandemic, that your company actually benefited from it and continued to grow. Are there any?
We just hope we're not like Peloton.
Oh, sorry.
What's going on? Peloton's crashing and burning. It's
I heard, yes.
You gotta be careful. You have to make sure they benefited from the pandemic, and now pandemic's not so big anymore. So there's an example of a great company that did really well, and then it's obvious they're having trouble now. It's all in the public. So and it could happen to anybody. And no one's too smart. And I think if those investors, and they had good people, they had a great idea, but as you scale and as you grow, you have to maintain vigilance. And that's a great example of two companies that Zoom is never. I think Zoom's never looking back, while Peloton's got to sort of reorganize a little bit.
Mm-hmm, for sure. Are there any misconceptions you have or see people have about startups?
Greg?
Gosh. I think what yeah, I do actually. I think people only see what's in front of them, right? You don't see the 95% of startups that fail. And I'm sure I'm too low on that number. It's probably something closer to 98%. Like, we only see the success because that's our culture, and that's what most people are familiar with. What you don't see is the number of people that try and fail, and people try and fail a number of different times. And I think for those of us that know, and you've probably heard some of these sayings before, is that Silicon Valley they look for people that have failed 3 times before they invest in them. And that's because, you learn from your mistakes, and that's very true. From my perspective, this is my first shot at really doing a startup. So I have a lot of people that would be betting against our success, just given the fact that, from my standpoint, it's my first rodeo. But we do surround ourselves with people that have been through this a number of times. And again, it's the thing with startups, it's not, you could have the same product, but you could have different teams and you're going to have very different results. And I would say with startups, you're not really betting on a product, you're betting on the people to drive that product. And I've seen this in so many different ways where, we'll go out and the first thing someone hands me is an MNDA or an NDA in their perspective. And they want to keep everything hush hush. And what I've learned in startups more than anything else is that if you have a great idea, tell the world, because you're the only one that's doing it, right? And you're the one that's going to make it success, but you're going to need others to help drive that success. So again, this kind of goes with the idea about transparency of communication is the most important thing, I think, both in Playback's mission, but also I would say in the startup world, because you need a lot of help if you're going to be successful. I know people that have great ideas, but they didn't share them, and those ideas died with the company. And you've really got to be willing to step out and share your ideas, network those ideas. And I think you can change the odds significantly from the 95 plus that fail into something more meaningful. And I wholly believe that, both from our experience. But I think from David and us, we're in our 50s, and so while we haven't done startups before, we've managed teams of people, of high performing people. And that's experience that you can't really put a price on. And I think it's benefited us very, very well to know what are opportunities, what are rabbit holes, all of the things that entrepreneurs chase. And if you're chasing it for the money, you're going to run into problems, because it's going to attract the wrong people. You're going to go down the wrong, you're going to change your product, you're going to change your business. And what we've really find is that as long as we trust the people that we're with and we're working with, whether it's investors, whether it's clients, or whether it's our own teams around Playback, that's where we've really had our most success. And so probably the most important thing that I would highlight, and certainly probably not well known about innovation and startups, is it starts with people.
It's a lot, I think, and Greg works really hard. You have to work hard. I think also you got to be afraid. You can't be afraid of failure, because it doesn't mean you learn from it, like Greg said. And I also think you have to know what you have. It's a drug, is it a device, is it an IT? To Greg's point, if you have a drug or a device and you're really worried about a patent, you can't just divulge your idea, because it's not worthless if you can give it away. That's why people are so protective of their IP and their secrecy around drugs and devices. But IT is very different. It's much more open, and you have to trust the people around you, like Greg said. And we basically told our idea to everybody, and if somebody takes your idea and steals from you, nobody can do what we're doing. We don't think anybody can. They may try, but you got to believe that about yourselves. You have to, and that trust has really helped us, because it lets us accelerate more quickly and find people that can help us. And I agree, Greg. I think if you're in an IT business, you got to have trust, because the IP is basically worthless following year. Somebody else just comes up with a better way of doing it. So we're of that ilk. We just trust everybody.
Yeah, I actually had no idea that there was such a high failure rate in startups, and it's amazing to see that your company continues to grow, and you guys definitely put in a lot of hard work. So what advice do you have for someone that is interested in startups?
In what way? As investors, as working, how do you think about it?
I think anyone who is planning, like for a student who, for my end, like someone who's graduating school and looking up different startups to get themselves involved in.
Yeah. Okay. Yeah. I said, I mean, the reason I ask is because if you're my age, you better have a partner that that believes in you and is willing to give you that, because otherwise it'd probably wreck you. And I know that for Dave too. I mean, Dave is somebody that wears more hats than anybody I know, to be a neurosurgeon and you know, and running a startup and everything else. Like and a movie star. I guess we didn't even talk about that. But you know, when you're wearing so many hats, it's really, really hard. You have to make sure that the people that, you know, that are part of your family believe it. So that would be the first thing. But coming out of college, my favorite things to do these days are to speak to young women and men and women that are coming out of college, whether it's undergrad or business school or even high school. It's like there's so much promise and optimism. It's so enjoyable to go back and look at that and be able to cultivate that. And what I tell every one of them is, like, make sure that the people you surround yourself with are the people that you respect and you emulate. And it you know, whether you want to do a startup or whatever it might be, when you're young, you have the opportunity to follow your passions, and to follow those passions, you definitely need to step out of your comfort zone. And you do that by exposing yourself to unique people, unique ideas, unique environments. So network the hell out of yourself, find those opportunities, do things that you normally wouldn't do. And that's really where the fun and the joy comes in learning new things. And a startup is very much the same thing. When I started a startup, as I said, I really didn't know software technology. I was a finance person. And so when I got into this business, there was a lot of stuff I didn't know. And the hardest thing for me to do was to put myself out there and start networking in wider and wider circles to find where we wanted to do and what I wanted to do. And so you've got a great thing you know, when you're younger, you have the ability to go out and really meet people, meet ideas, challenge yourself, and find something that you're passionate about and find the right people to go after it. When you're 20 or 30, or in my case, 50, and you're making a career change, it's a very different question and a very different answer. So it's a personal thing, but it all comes with finding your passion and making sure that, you know, the people around you are supportive of it, because it's really hard to do alone.
I mean, if I was starting all over at the beginning of my life, I would. This is the time to take some risk when you're young, before you have a mortgage and children and pay taxes and you have all these responsibilities. This is the time to lock in, take some risk. If you're thinking about joining a startup or you have an opportunity to join different startups, I think it's going to be important that you really, you should interview them as much as they interview you. And, our company, we hire people. We're very careful about the people we hire. We have a way of grading them, because what's so important, your people are more important than anything, who the people are in your organization. And but you, by the same token, have to know yourself. If you really want to get involved with a startup, meet the people. Make sure you have to look them in the eye and trust them and find out. You ask them good questions like, how successful have other young people been in their company? What's their mission? Where do they see themselves taking this company in 5 years? Understand the idea and believe in it. Don't just do it because it can make money. And if the people you meet are like, oh, we want to turn this into $1 billion company, it's all that matters, we want to be the next unicorn, respect the fact that it's not really should be the most important thing, even if they think it. And so if you really want to join a startup, which I would do, if I was fresh out of college, I would absolutely look to, because the upside is so great and there's not a lot of risk, and you'll learn even if the thing fails, and you'll come away with a good experience, and then you can do it again. And it's so many people get really conservative and they do the usual and customary. Be contrarian, go try something that no one's done. You're much better off, especially when you're young, to do that, certainly when you're our age, and take this kind of risk. And I think that it goes without saying that it's going to be a lot of fun, and you absolutely will learn from it, and you have plenty of time to worry about everything else.
Thank you, Dr. Langer and Greg, for this great discussion. It looks like we have time for some questions and answers. If anyone in the audience has any questions, make sure to type them into the Q&A box. I see that there's one in there. First question is, It disappeared. Oh, Greg, it looks like you already answered the question.
Yeah, sorry, I went ahead and answered it. It's a great question.
Do you want
You
to
want me
talk
to,
about it out loud? Yeah.
Yeah, sure. I was kind of thinking like, once you put it in print, you can't take it back. The question is, did you set up the business first and then get clients, or did you have potential clients lined up first and then set up the business? This is a great question. People talk about it all the time. You have to have, we talked about this before. There has to be a problem and you have to have a solution. And once you define that and you determine that you have product market fit, then you have real go-to-market potential. So for us, for us in Playback, David had done a retrospective study back in 2017 based on data surrounding the use of video in moving patient experience scores. So for those people that aren't familiar with that concept, it's the idea that patient experience matters in healthcare because patients that feel more cared for are likely to have better outcomes, right? And it's one of the reasons that the Affordable Care Act was enacted, to focus on the value of care provided rather simply than just the volume of care provided. And the idea there is that the CMS, which is the legislative body for healthcare in the government, they really wanted to bang home the incentives to healthcare providers to really care about the value of the care that they were providing their patients. So they had this concept of patient experience scores. And it's basically when you go see a doctor, you get a survey and it says, did the doctor explain your care? Did you understand your discharge instructions? Did you feel heard? Did you get your medications? All of these types of questions that are really important. And then depending upon your score, it goes back and figures into the payment of services that insurance companies will pay hospital providers. So if you do really good on those scores, you have a tendency to be able to charge more for your services. You get more of your retained earnings for with insurance companies and other things of that. But that's a long-winded answer to understand that patient experience is really important in determining if your technology has potential. And David went back and did a retrospective study and showed that the use of video in communicating care with patients moved patient satisfaction scores a lot. And it was such a big number that the C-suite at Northwell understood how important video was in the process of care communication. And that's what really got us our start. So we already had a universe of folks that understood the power of communication in the care delivery process. And that gave us a leg up for sure, but we didn't have a product, right? There's nothing that we could actually show and use because technology had moved so far ahead of where the technology that was in place at the time. So we had to go back to the drawing board and redesign from the ground up a proof of concept that allowed us to then go back to the health system and say, this is our product that we want to build. And Northwell agreed to be the sandbox for us to prove it. And that's what really gave us our great leg up. And without that, we wouldn't have been able to showcase our product. So we built the product and then we went back and used it in neurosurgery. And then the pandemic happened and use of Playback ballooned in Lenox Hill because all of their hospital beds were going to COVID patients. And they needed a tool to help communicate between providers, patients, and families. And Playback was that tool. And that's how the pandemic really accelerated our use in the hospital. But it's very situational to us, which is why I keep going back to say, you got to make sure that there's a real need for the solution that you're providing. Cool tech only gets you so far. You have to have an enduring need that provides you the opportunity to use great tech to meet that need. And that's kind of Playback was at the right place at the right time. But it was really this idea of product market fit and knowing that you have it in order for you to scale it.
Yeah, I also think you have to be really careful. Healthcare startups are very different than startups in other areas where when you're say to start with a consumer, The problem with healthcare in general is that who you're selling it to, who's buying it, especially in healthcare. It's crazy. I mean, the people who need it aren't buying it, and they're not asking for it. And the people who are buying it don't actually create the deliverable. So it's very inefficient. There's so much friction with these different layers. We really benefit from being inside a healthcare company from the beginning. So we were and they were one of our primary investors too. So that really eased some of this friction. It took time because the vehicle that invested had nothing to do with the rest of the healthcare company. But our experience being inside out clearly had advantages. I think if you're doing a startup that's purely on the outside in healthcare, buyer beware. It's a really tough spot. And unless you have the idea that's makes a lot of money with low friction, it's going to be tough because the legacy environment in healthcare is very, very challenging, and the people who are making decisions are risk averse. If you're in other startup, I mean, if you're Uber or if you're another company like that, which has absolutely is fulfilling a need to the consumer, that's a completely different kind of startup. You're selling it to the drivers and the riders. That's a different problem. But I do think that in healthcare, it's best. You really need good advice, and you really need good practitioners. Or it depends. It depends on the type of health. Some people are healthcare things are purely financial or are very patient driven or very provider driven. But just make sure you understand who the people are that you're selling it to, who's the buyer, who's the seller, which is you, and who you're providing the benefit for.
Thank you. A couple more questions are coming in.
Yeah, I'll take Stevens here. I started typing it out, but it's multi-layered. So we started in Lenox Hill Neurosurgery with David and his team. That's where we first piloted. That was late in 2019, early in 2020. And then COVID happened and everything changed. What were some of the lessons learned? Don't release too early. I think we knew we had a great product. We had a couple of doctors that really understood it and used it and were great with it. But they knew it, and they were willing to go through the troubles that sometimes, when you first start out, you don't have the easy tech. And so I think going too early was a problem for us, but was also a plus because since we were already there, then we could have launched during COVID. So that's kind of a hard thing to say on the one hand, don't go too early, but we did. And it actually was super opportunistic for us because of where we existed when Lenox started to fill up with COVID patients. What do patients and providers think? I think what I love more about this than anything else is how surprised people are by bringing in everyday technology that you and I use with friends and family, bringing it into healthcare and seeing the types of results that you can. So for David, at surgery, just to use Playback to connect with the families that are in a waiting room, say, we're just getting out of surgery, everything looks great, I'll see you in 30 minutes. Just something as easy as that, and the stress factors that come down and the relief, you can feel the exhale of people hearing from their doctor firsthand the information that they need to lower the stress in the room. But this goes with a lot of different ways. We're communicating medical instructions in a way that people can easily understand it, and it's memorialized and you can share it. We're making it easy. And to make anything easy in healthcare blows people away. So providers and patients, when they see this, we had a doctor down in Florida who's an orthopedic surgeon who used it for the first time, invited a patient, invited their family, immediately got a message back from the patient and the family saying, this is amazing. He shared their diagnosis and care plan with them for a reconstructive surgery. And they were completely blown away by it. And the doctor wrote immediately to the head of the CEO of the hospital, said, this product is amazing. I just onboarded my first patient. This is the feedback that I got. Why don't all hospitals do this? So, that is for people that have used it and see the immediate impact that they're having on patients, which is a great thing. We just discharged a patient here in Lenox, and a nurse used Playback for the first time to record an audio discharge instructions. And 5 minutes after she recorded that discharge instructions and shared it on Playback with the family, the head of patient experience came down and said, I just got the notification that you just did this audio discharge instructions. That was amazing. And all of a sudden you realize the nurse had a big smile on her face, the patient had a big smile, The family that was at the point of care was able to see it. The family that was away from the point of care was able to see it. And immediately the feedback was, this is amazing. And that's the kind of like that. That's why we're doing it, to bring that type of connection at the point of care is really super important to us. Have you completed any studies from any clients on how Playback improved provider in readmissions? We just launched a study in Stony Brook that is focusing exactly on this, readmissions for cardio. And the idea is that based on some other studies that have been out there that have shown context around the discharge process, we're using video and audio around it, and we want to prove how by how much Playback improves readmissions. So that is something that we're working on right now. I have a startup related to high reliability and psychological safety. Where have you been inspiring and validating system thing? Where do you look? Oh, where would you look for healthcare investors? I would start with the healthcare investors that can really help support your products go to market, right? Again, don't go for the money, go for the people that you can help. I cannot emphasize how important it is that when you go get investors, you're going to have these investors for a long, long time. And particularly if you're going to start putting them on your boards and stuff, it's really hard to get rid of investors. It's really easy to find them if you have a good product market fit. So I would say really focus on the people, focus on their ability to help your go-to-market, help you to find clients, help you with product development. There are some really great people out there that are really smart about the whole healthcare ecosystem. And if you tap into the right people, I think you're going to have a lot more success. What is the story behind Dr. Langer's time? Oh, Dave, this is for you. Megan.
You were going to answer that question. You were doing so well.
I want to know why we call you Mr. Hollywood.
That was luck, honestly. You know, I trained a guy an Israeli fellow who was in the Atlantic Hill equivalent in Israel, and the two movie makers. It was so successful in Israel. They came here. They called him because he was in New York. He said, "Look, I can't pull this off, but call Langer." That's honestly how it started. I met with them in early 2017, and there really was no Netflix yet. It was unclear what the streaming service they were going to use. Netflix was still, it was popular then, but not nearly as popular as it was now. But they basically secured a Netflix contract by early 2018. We started filming in April, so of 2018. So it was quite a journey, and I consider myself really lucky to have been a part of it. It's we did it to show, because we knew we were legit inside our department, and it turned out to be one of the great experience for us. So it was due because of a relationship I had, that someone who I crossed paths with and really thought that I, could pull something off because he knew me, gave me the opportunity. So that's another example where, you never know, and treat people well and good things happen.
Awesome.
The next question here is, when you first launched Playback, where did you pilot it? Oh, this is the same question. Another one, it's an inspiring story and experience sharing. Thank you. Does Playback any student internship? Yes, we do. We have, we have lots of different opportunities. We've had different internships, and especially in the summer, it's hard for us to do research at Northwell is one of the problems, because Northwell is an investor, and their conflict lawyers are reluctant to have them be part of any research at Northwell. But certainly, if you're looking for an internship opportunity outside of study, where you just want to be involved in seeing how a startup works, or and try to contribute in any way you can, I'd urge you to reach out to Greg and the team. And I can't imagine we wouldn't create an opportunity, especially in the summer, for you to sort of schmie around and see what we're doing.
Thank you. There's time for one more quick question. Greg, do you want to talk about, I think you answered, sorry if I mispronounced your name, Sahil question. Did you get a copyright patient protection of your idea and software before sharing your idea widely?
Yeah, so I quickly bang this out. It's a longer question, but there's a process to do a provisional filing on your idea, and that protects you for a year. And then after that, you do a non-provisional, which is more significant and helps for longer. It's really hard to IP software, and there are ways to do it. We actually went through the process and ended up not continuing with our original idea, our original IP, because we realized, we had something better and more important to what we were doing. And it's not because our idea changed, it's just because the way that we wrote the patent changed. And so it's important. You don't want to spend a lot of money on it. You want to protect what you can. It's important when you go to investors. But in software, it's much harder. Hardware, obviously, there's a much bigger opportunity. So it's very product significant. But yeah, we went through the process, and you kind of you have to really think about your spend. And again, make sure you find the right legal team to help you with that. We actually have a great general counsel who David know from very far back, that we brought into our process very early, because again, we knew what we didn't know, and having the right legal people on our team was really a big thing that we did. So give a little extra equity up to make sure that you have a good general counsel early, and that'll help guide you.
Thank you. That wraps up our Q&A. We are coming up on time. Dr. Langer and Greg, thank you so much for answering these questions and providing further feedback to our attendees. I would again like to thank our panelists for sharing their expertise and insights with us. And I would also like to thank everyone in the audience for setting aside an hour of your day to participate. Visit ctahe.org to see our upcoming programming. And please make sure to follow us on our social media channels, LinkedIn, Facebook, and Instagram page. Please stay safe and have a good night.
Thank you.